A new report in the Wall Street Journal has rattled the public health world. It says Health and Human Services Secretary Robert F. Kennedy Jr. plans to fire every member of the United States Preventive Services Task Force, the 16-person panel that decides which screenings, tests, and preventative drugs must be covered free of charge under the Affordable Care Act. The department says no final decision has been made, only that it is reviewing how the panel can better support the administration's goals. Even that hint of change has set off alarms about what could happen to no-cost preventative care for millions of Americans.
First, what exactly is this task force? Created in 1984, it's an independent volunteer group of primary care experts, think practicing doctors and nurses, not politicians. Their mission is straightforward: review the best available evidence and grade preventative services on whether they improve health. Cost is not part of the equation, only clinical benefit. The panel assigns letter grades, and that grade has teeth. Under the Affordable Care Act, private insurers must cover anything that earns an A or B grade, with no copay, deductible, or co-insurance. That's why mammograms, blood pressure checks, depression screenings, and the HIV prevention pill PrEP are free for most insured Americans.
Why might Kennedy want the panel gone? According to journal sources, he views it as too woke, objecting to language in its reports, phrases such as structural racism or pregnant persons. The task force has also drawn fire from conservatives for its A grade for PrEP, which led to a legal challenge that reached the Supreme Court. In June 2025, the court upheld the constitutionality of the task force's role, but it also confirmed that the HHS secretary can appoint or dismiss members at will. In other words, the power is Kennedy's to exercise.
There is precedent. Last June, Kennedy dismissed all 17 members of the Advisory Committee on Immunization Practices, the group that guides the CDC on vaccines, and installed new appointees, several of whom are openly skeptical of routine immunizations. Public health advocates fear the Preventive Services Panel is next in line.
What happens if the current task force members are replaced? New appointees could revisit existing recommendations, downgrade key services, or delay new ones. If, for example, a life-saving screening slips from a B to a C, insurers could start charging copays or drop coverage altogether. That shift would be felt most by people who rely on early detection or preventative drugs to stay healthy.
The prospect has united more than 100 health organizations, from the American Medical Association to disease-specific advocacy groups, in urging Congress to protect the panel's independence. They argue that evidence-based, politics-free guidelines save lives and money by catching illness early.
For now, the task force's next scheduled meeting is on hold, and its members remain in limbo. Whether Kennedy follows through or backs away will determine if preventative care stays a guaranteed benefit or becomes another battleground in the healthcare culture wars.